Hi everybody, this is Dr. A. I'm bringing you your public health lesson here in Nearpod, and what we don't cover in this chapter is covered in the homework assignment that's been sent to you. So we're going to talk about determinants of health, and we're going to look at also the core public health functions of assessment, policy, and assurance, and the role in public health organizations. In your homework, you're going to be talking about epidemiology and the epidemiology triangle and its importance to public health. And again, we're just quickly going to review back over primary, secondary, tertiary, and coronary prevention. We've covered that already. A few did you know? So established in 1905, the civic organization, the Rotary International, Rotary Club, has played a huge role in eradicating polio through an international vaccine programs. Rotary does actually a lot of stuff. In 1992, a national exercise program for Medicare patients called Silver Sneakers was created to provide free access to organized exercise and national fitness change. So the idea there is to allow seniors to exercise, and usually so it's access to gym, right? It's usually some kind of basic gym membership with some classes and stuff like that that are targeted for elderly people, and that in turn strengthens them, which prevents falls, and which then prevents hospitalizations and stuff like that. So Silver Sneakers is a great program. A newer form of surveillance is called biosurveillance, which monitors patterns of unusual disease and maybe that might be the result of human intervention. So that is new, pretty much post 2001. And so let's talk about public health and what is public health and how it's defined. So there are two important definitions of public health. The first one, the first definition was given by Charles Winslow in the 1920s, and it was defined as the science and art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts for the sanitation of the environment, the control of community infections, and education of individuals regarding hygiene to ensure a standard of living for health maintenance. And so just to give you an idea, like, would you want this beach to be your community beach? So sanitation and all of that is important, but it's also the environment is important, and so it's a big part of public health. Obviously, this is not a very healthy environment to be able to go into. The IOM, in its 1988 Future of Public Health report, it defined public health as an organized community effort to address public health by applying scientific and technical knowledge to promote health. So again, organized community effort. So it takes the whole community. It takes the idea of public health is usually something that's policy or institution-based or community-based or state-based or something like that, where it's and it affects many people's health. So again, both definitions will point to broader community efforts to promote health activities to protect the population's health, in contrast to traditional medicine, which just focuses on the individual and then, of course, is effective less whether or not you have access to, a doctor or to healthcare coverage and that kind of stuff. All right, so the Affordable Care Act emphasizes the importance of prevention and wellness, and those can be part of public health efforts. Okay, so let's talk about health. Like, what is health? There are several definitions. The WHO, so the World Health Organization, in 1942 defined health as the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So meaning there that so we tend to focus on the physical health. So it's like, oh, there's nothing visibly wrong with you, so therefore you must be healthy. But what if they're having some mental issues? Maybe they aren't healthy then. Or what if they're having a lot of problems that are social, like within family or relationships and stuff like that. And that in turn can affect the mental state, and in turn that can affect their physical state too. So the IOM, which is the Institute of Medicine in 1997, defined health as a state of well-being and a capability to function in the face of changing circumstances. It is a positive concept of social and personal resources as well as physical capabilities. Here's a good example. since we're going through all of this, when back in March, kind of the country halted, March 2020, because of coronavirus, and a lot of us were sent home, everything changed on it. I'm like, how were you able to be flexible and to change with the circumstances that changed? Okay, were you able to just quickly adapt and overcome? This is completely turning your life upside down, and you're just frozen in fear. Like, where were you? And so, a healthy person ideally would be able to have great flexibility when circumstances change, and they can easily adapt. According to the Society for Academic Emergency Medicine in 1992, they say that health is a state of physical and mental well-being that facilitates the achievement of individual and societal goals. So, like, health allows you to pursue your careers and other things like that, and it allows you to grow into the person that you're meant to be and achieve your full potential and stuff like that. And then as you achieve your full potential and help others achieve their full potential, then society as a whole can grow. But that is based on health, right? And so we're going to do an activity here of what does health mean to you. So I want you to answer that. But before that, I'm going to show you a slide I thought was really good. This is a quote I've heard many times. So the Dalai Lama, when asked what surprised him the most about humanity, answered, man, because he sacrifices his health in order to make money, then he sacrifices his money to recuperate his health. And then he's so anxious about the future that he does not enjoy the present, the result being that he does not live in the present or in the future. He lives as if he is never going to die, and then dies as having never really lived. So I want you to think about that for a second, and then in your Nearpod activity for my class, please answer, what is health to you? So let's talk a little bit about the social determinants of health, or determinants of health. So there are several determinants or influences that impact the status of an individual's health. So we're going to start inward and work our way out. So first is individual lifestyle. And those are things just as exercise, sexual activity, diet, and then constitutional factors, which have to do more with like your genetics and stuff like that. So how strong of a person, not so much physically strong, but how resilient you are. To just go like to dogs and cats. So in kittens and puppies, the runt of the litter has usually a weak constitution. So maybe that gives you an idea. Okay. So those are all factors, except for the genetic stuff. All the others are factors that you can control through behavior and stuff like that. So those are direct determinants of a person's health, and they're generally under the person's control, conscious control, or choice and stuff. So they can decide to engage or not engage in exercise, and they can you can pick what you put on the end of your fork and put into your mouth and stuff. Then, of course, within the immediate environment of a person, there are the social and community networks. So those are external influences on health. From that comes the concept that, like, basically your health is influenced by the 5 people that are closest to you. So if the 5 people that are closest to you have a lot of health issues or are very unhealthy, chances are you're probably going to be unhealthy also. But the reverse is true. If you surround yourself with people that have good habits, that eat healthy, they exercise, they have a focus on health and healthy relationships and stuff like that, then that in turn will influence your health positively. And then moving out even more, you have the microenvironmental conditions, so the bigger picture. So socioeconomic, cultural, and environmental conditions that can impact health. Where you live, your neighborhood, your place of work, the level of education that you have, living working conditions, your the access to healthcare services in your area, food production and stuff, and how well it is, or and how much access you have to good foods and stuff like that. Water and sanitation, there's the beach, if you live near a beach, those that look nice and pretty and clean, those that look like that beach picture I showed you guys earlier, right? Housing, how is the housing? Is it fit to live in or not and stuff? Now, some of these will also affect the individual choices, because, for example, if you're living in a neighborhood where, let's say that walking around could, maybe you're out in the country and walking around, you're walking alongside roads that have no sidewalk, you could get hit by a car. Okay, that would be a problem because that would affect your ability to exercise and your decision to exercise and stuff like that. If you were in an urban area and you were in a bad neighborhood, walking around could get you shot or something like that. So maybe then you don't go out and you don't exercise and stuff. So according to Healthy People 2020, the social determinants of health include your neighborhood and built environments, health and access to health care, your economic stability, so income, job, all of that, resources coming in, your education, and your social and community context. So those are all your social determinants of health. These are a priority of Healthy People 2020, and their goal is identifying ways to create social and physical environments that can promote good health for all. So some of the programs out of that have been adding sidewalks and stuff in areas and neighborhoods, especially in rural areas that didn't have them that were needed, so that people could walk, kids could walk to school safely, or people could walk around their neighborhood for exercise and stuff like that. So I'm going to, I do want to share this because this is a tweet that I came across earlier this week. And I'm going to start on it from the first and read through. So you can see who it is and follow. So why do you want to be a doctor? I answer without hesitation. I want to help people. There are many ways to help people. I want to save lives. There are many ways to do that too. So I'll ask you again, why do you want to be a doctor? Because I believe in it. Okay. I think about that exchange now and then, and sometimes more than others. Why do we do the things that we do? What do we really believe in? My next clinic patient is one I've known for many years. He is visiting me today via Zoom. I always look forward to talking to him. As soon as the visit begins, I notice his camera is angled off center, so I can't get a clear look at his face. I ask if he can adjust it, but he says he's having technical issues. No problem, I can adapt. It isn't just a camera though. Something feels off today. Almost immediately, I can tell that he sounds subdued. He isn't cracking his usual jokes. I'm comfortable with silence, even in the heart of a busy clinic day. Silence is often where healing happens. After asking how he's doing, I let the silence between us grow. The question when he asks us is one that I don't expect. Doc, which kills you faster? Blood pressure you don't control or blood sugar you don't control? The surprise on my face must register because he explains further. I just can't afford all these medications anymore. The way I see it, Doc, I only need to stick around 4 or 5 more years. That's how long my pet dog has left. Then I ain't got no more family and it's me all on my own. So I figured maybe take the diabetes one and skip the blood pressure or every other day. That right there is, sorry, let me keep, so keep following, there we go. So as I review his meds and start discussing our options with him, he adds one more last remark. And I'm real sorry, Doc. I know we go way back, but I can't afford my copay. I'll pay you later, promise. And just like that, I understand why his camera is angled. And just like that, I'm again struck by the cruel illusion of what I do, the system I'm a part of. This patient did everything right, got insurance, paid his taxes, and he still has to barter years of his life. And he can't bring himself to look me in the eyes as he does so. Our healthcare system is too often unethical, immoral, and unsustainable. The insurance paradigm is focused on revenue generation. It strips the basic human dignity from patient to the point where they can't even make eye contact anymore. I know that I'm part of the system. He's old enough to be my father. Some part of me imagines that he is my father. Tears threaten my vision as hot anger floods me. Now I wish I could angle my camera away. I ask him if I can write about him because people need to know. His response lingers with me. Sure you can, Doc, but people already know. Lots of people deal with this. It ain't people that people don't know. It's just that nobody cares. Nobody gives enough of a damn to change anything. Nobody cares. The visit ends. My Zoom window closed. His window closes too. There's something insidious here. A casual cruelty we're all complicit in. I can't go to rehab. Insurance will cover it. Insurance will pay for that medication. I can't afford any of this. I'm uninsured. That isn't right. None of this is right. 20 years ago, I gave a medical school interview. I wore my best suit, sat up straight. I said I believed in medicine. I meant it. Some part of me Once burn brightly, but that fire down to flickering embers. Otherwise mean more than this. More than this. So there you go. This is an excellent tweet, and it really reflects some of these social determinants of health, having access to health care, but having the resources also to buy the stuff, and these things make a difference. So I will put this link also, but in your Nearpod, there's this video. I'd like for you to look at it and to listen to it. It's about 10 minutes, a little bit less than that. And it's about food as an invisible form of oppression and as a social determinant of health also in our food system. Then answer this poll question and answer this open-ended question. So I'm going to skip through that because this is a virtual Nearpod activity and stuff. And I will link it in YouTube also, just for you guys that are following there. So let's go to primary, secondary, tertiary, and quaternary prevention. We talked about this earlier before in another chapter, but primary prevention activities, they focus on reducing disease development. So this would be smoking cessation programs, immunization, employee safety education, etc., things that keep you from getting sick. Secondary prevention activities refer to early detection and treatment of diseases, so high blood pressure screenings, looking for high blood pressure, colonoscopies, mammograms, cholesterol screenings, blood sugar screenings, and all of that. Your tertiary prevention activities will focus on trying to rehab and monitor disease that's already developed. And your quaternary prevention focuses on experimental medicine, and it must be treated with ethical interventions to ensure the patient is receiving appropriate treatment. So this is, again, one of those like, yeah, we can do it, but should we? As like deciding, as some of those are more like end-of-life decisions, and diseases aren't going to be getting better. So that's be more quaternary prevention. And public health, since we're in public health right now on this chapter, basically focuses on primary and secondary prevention. So preventing diseases from happening or detecting them really early. So the origins of public health are with three men: Edwin Chadwick, Dr. John Snow, and Lemuel Shattuck. And they all demonstrated a relationship between your environmental conditions and public health. Dr. Snow did the link between contaminated water and disease. Chadwick looked at unsanitary working conditions and disease, that relationship. And Shattuck is at the beginning of public health infrastructure. So for the CDC, what is public health? And so let's look at the components of the public health system. So who are all the players in the public health system? So first we have our public health agencies at the state and local level. So this is your local health unit, your state health unit, etc. Healthcare providers, so doctors, clinics, hospitals, and all of that. Those are all also part of public health because patient accesses healthcare system through them. And you can do things in those settings for prevention. You can educate and all of that. Public safety agencies, human services and charity organizations. So think of things like food bank and stuff like that, food access, education and youth development organizations, things like CD Youth and all that help maybe tutor young people or give them sports and character development and all that kind of stuff. Recreation and arts related organizations, so community centers and all of that, where you can go to parks and all of that, but also be able to participate in arts related things. Economic and philanthropic organizations, so these can be some other charities, so like churches and stuff like that, that can give access to different services, or sometimes simply food, or food, shelter, clothing, and stuff. And then environmental agencies and organizations. And so you can see all of these and how they can be related. So you have your public health agency, elected officials, faith institutions, laboratories, mental health, fire, transit system, getting places and all of that, community centers. We have civic groups, neighborhoods, schools, EMS, hospitals, doctors, drug treatment clinics, law enforcement, corrections, employers, community health centers, tribal health, and all of these things. So what are 10 essential public health services? So first one is to monitor the health status to identify and solve community health problems. So if you remember a few years ago, we were having some problems with hepatitis A outbreak. So this would have been part of public health services. Arkansas Department of Health was heavily involved into there. We saw an uptick in cases, and they were tracking them and stuff like that and trying to solve the problem by giving immunizations and stuff to hepatitis A. You can also diagnose and investigate health problems and health hazards in the community. So that was one that they diagnosed, investigated in this community, in this area. You can then inform, educate, and empower people about the health issues. So this can be things like right now currently with the social distancing and masks and wear, like a year ago, who would have thought, right? But we got informed and educated and stuff like that, and we can make choices about whether, you know, to quarantine or not quarantine, stay at home, go eat out, not eat out, pick up food, you know, like you can make choices and stuff. And then mobilize community partnerships and actions to identify and solve health problems. So this is where, for example, when we had, again, go back to the hepatitis A outbreak, there was, we partnered, the campus partnered with the Arkansas Health Department and even like pharmacies like Walgreens and others, the pharmacists, and they were coming on campus and doing drives where you could come and get a Hep A shot and stuff. And so that's, again, a community partnership to that helps solve that problem. You can develop policies and plans to support the individual and community health efforts. So again, just might help, you know, just how to do it, how to implement and all that, but also maybe find some funding in there too with the policies and stuff. Enforce laws and regulations that protect health and ensure safety. So we saw that with the mask and social distance audit. Regulations that were put in place was like technically it could be enforced and you could be asked to leave a place if you did not have a mask on, although you know, enforcement's not been like really stringent, but it could be. Link people to needed personal health services and assure the provision of health care when otherwise unavailable. So then again, through public health and different agencies, you try to connect people to services. Assure competent public personal healthcare workforce. So if you want to practice as a nurse or as a physician or something, you have to get your license to practice through the Arkansas Department of Health here in Arkansas, or to your, you know, local, usually health department. Evaluate effectiveness, accessibility, and quality of the personal and population-based health services. So they look at what's going on at the hospitals and the clinics and all of that. And then research for new insights and innovative solutions to health problems. So let's talk about health education and health promotion. So health education helps change high-risk behavior through education. So a stop smoking or stop vaping campaign is health education to aim to change a high-risk behavior. Health promotion is a broader term that looks at community, environmental, and economic interventions. So the focus would be on changing some social determinants such as lifestyle behaviors, but it could also be access to again, like access to sidewalks so you can go walk, or putting a park in so kids can go play and stuff. Public health education campaigns can fit right there into health promotions. And obviously, one of the big things is you want to evaluate if the programs are effective, because if they're not effective, then you don't want to keep pouring money into something that's not yielding any kind of results. All right, so let's talk a little bit about social marketing. So social marketing draws from the business discipline of marketing theory and then adds science-based health strategies of promotion and prevention for public health. The marketing mix brings so the idea of product, price, place, promotion, and then with the public health, we're going to add publics, partnerships, policy, and purse strings. So product is like, what is it you're trying to sell? So obviously for traditional business marketing, it might be, you know, the newest iPhone or the newest smartphone or whatever like that, but For public health, your product might be stop smoking. Your product might be lose weight. Your product might be get your blood pressure under control, okay? The price is not so much how much people are willing to pay for the product, but what people usually are willing to sacrifice, because a lot of times you're looking for behavior change, all right? So that would be the kind of the price, like what's the pain point there. Place, so place and placement, so in traditional marketing, product placement is really, really important. So on there, like if you did a stop smoking campaign, let's do a small stop vaping campaign, like what's the placement of your message going to be? Like, where is it going to show up? Because you need it to show up where the people that need to hear it are, right? And promotion, you need like buy-in. So people want to hear the message, they need to buy into the idea and be like, oh yeah, this is something I should do and all that. So the publics are, again, like, who are you targeting? Who's your audience? Who is at risk for this behavior and stuff? If it's a stop vaping, your public might be a younger public. If it's a prevent fallen elderly, your public may be an older public, and they will be in different locations, or they'll be even digitally in different locations and stuff. And so that would be, where do you reach and stuff? Partnerships, can you partner up with other already existing infrastructure? So can you partner with Facebook, or could you partner with Instagram, or could you partner with a local TV station, especially if you already have an already made video or something? Could they just run it for you for free because it's a public health service and stuff? And then policy and purse strings are the policies that can be put in place and stuff to facilitate facilitate the message and all that. And in purse strings, who's funding it? It involves creating, communicating, and delivering health information and innovations using obviously customer-oriented and science-based strategies. And the idea is to protect and promote health in diverse populations. So again, with social marketing, you want to put the message where the people you're trying to target are. Okay, and you want to put it in a language also that they will understand too. So a little bit on social media here at CDC. There's some fun stuff you can look at, but they have social media and digital tools here that can be investigated. They have guidance tools on how to write for social media, a Facebook guide, a Twitter guide, and so on. And there's some more stuff here. Also, health communication. So this is an important thing. So again, resources for writers, podcast, but this health literacy stuff, sometimes thinking about it, if you're educated, you will think on a different level than sometimes the people that you're trying to reach. And it's good to run the stuff, if you're creating material, creating videos and stuff like that, to figure out like what reading level or what comprehension level is this at, and is this adequate? And believe it or not, for most things that you want to put out to the general public, it needs to be on a 5th grade reading level, comprehension level, and all of that. And so knowing how to do that and how to make sure like what level your stuff is at is really important so that your message can reach the people and be understood. Social media and health. So social media are electronic communications dedicated to community-based inputs, interactions, content sharing, collaborations. So websites and apps dedicated to forums, microblogging, social networking, social bookmarking, wikis, all of this kind of stuff. So it's, it's everything. TikTok is part. You can use TikTok for public health. That's one of the latest ones. Facebook, Instagram, Twitter, Reddit. I mean, there's so many things out there. YouTube, and even games and things like that. It's just, there's a lot out there that can be done with social media. So I'm going to show you real quick. For example, the CDC has a Facebook page, and they obviously have stuff on coronavirus, but here you go. They have little quick videos they've produced. They're not very long. Question answers, and you can share that. And sorry about that, and all of that, and help disseminate a certain message and stuff. So sometimes something that you might be looking for, a message, can be already created. So they just one example of, things that are on social media that you can use to share to spread a certain message. So how to use social media. You want to perform market research to determine your key educational messages, what's out there, what needs to be changed, what do you want to convey out there. Review the social media sites by user statistics and demographics, like who's where. Okay, if you're targeting an older population, you might be able to, you should be able to find them on Facebook pretty easily. If you want a lot of the younger ones, they're probably going to be on, maybe they'll be on TikTok or Instagram or Snapchat, right? And so again, you start a campaign by using low-risk tools such as podcasts and videos. Like, people can watch a video. If you don't like the video, you just skip over it, right? So that's very low risk. And your educational message has to be based on science, so no, weird off stuff. You want to develop a system of easy viral sharing by patients so that everyone can benefit from the message. So for example, those videos are just pulled up from CDC. It's very easy. You can just hit the share and you can share that video. There you go. So, and then somebody sees it and they can share it and things can go viral. So you want to make it easy for the message to spread. And then, of course, social media users should listen to each other. If you're seeing concerns and questions and stuff, you should answer them if you have the answers, obviously, especially if you're in public health. And you should leverage social networks to expand the message, so messages can go viral, especially if they're well created. For example, an average Facebook user has 130 friends with whom he or she can easily share a health message. And a lot of people have way more than that. So, how can social media be used to improve public health? Answer that question. And so in conclusion, public health is an integral component of life and surrounds consumers with educational opportunities to change a health condition or a behavior. For example, we've had several successful vaccines that have targeted childhood diseases. Tobacco use has decreased significantly, so these are all good public health wins. We have safer workplaces because of OSHA. The fluoridation of water has been established, and that is helping with cavities and stuff in teeth. Decrease in mortality from heart attacks. All that's improved with public health interventions. And then public health and traditional medicines have been collaborating more and more. All right, and that is your lesson for this week. Thank you.